Hello, everybody. It's Monica Heltz with your weekly metric review for the Fishers Health Department. Today, we are going to update and go through our metrics for our community risk rating. We are going to stay in orange, and we'll go through what each of these mean. So our percent positivity rate for our Fishers Health Department testing site is at 7.55%, which is in our orange category. That is a clear increase from last week. Our county rate, which is the primary of the two metrics that we consider, is again individuals tested, and we get that straight from the Indiana State Department of Health website. It is 11.5% today. It's a very marked increase from last week and is clearly in our red category for our metrics. And our case incidence rate from our 14-day rolling average for Fishers Health Department for all Fishers data, is 22.34. So that's the average number of cases per 100,000 of our population on a 14-day rolling average, and that is in our orange category. So we have one of our major metrics in red, the other in orange. We're going to stay in orange this week, but if we hit both metrics in red at any point, we'll move the metrics at that point. We won't wait until next week, and be prepared for additional guidance to come out when that happens, because clearly we're getting to a point where this community transmission is unsustainable, and we're not at a point where we are going to be able to get ahead of it if we don't take increased measures. So I'm calling on all of you to see what you can do, what additional mitigation strategies you can use to decrease the spread of this virus in your home and in your community. And we'll talk about that here in a second. Let me just go through the other metrics. Our public health capacity is our secondary metrics we look at. Our testing availability is still, you can get a test in 1 to 2 days. That's in our green category. Although it is getting a little bit harder, you can still get a test in the next day or two. Our turnaround time is still in the under 3-day category. We're going to put that in green, but typically it's somewhere in the 1 to 3 range for number of days it takes to get your testing results back. Our tracing capacity is decreasing. We have a lot of contact tracers working up to 10 hours a day, trying to get everybody notified that test positive, let them know that they're positive, trace their contacts, and then notify all those contacts that they're positive as a first step. After you get notified by us, the next step is the State Department of Health will be sending you text messages for follow-up. So it is important that you answer those calls and that you know what the guidance is for when you test positive or when you have been contacted, that you're a contact to somebody with COVID. So please answer the calls. It is getting, like I said, hard to trace. We got 23 cases from the schools today, and that resulted in over 150 contacts that needed to be notified. So the schools have a good notification report. I would advise you to look at that first. It may take us a little bit longer to get to the school contacts. We already know at least that they're contacts. Healthcare capacity is in our yellow category as well. Hospitalizations are increasing even in District 5, which is our area, and the capacity is therefore decreasing for the hospitals. They're not at surge capacity yet or critical capacity yet, but certainly the more the hospitalizations increase, the more that becomes a concern. ICU beds, we still have nearly 30% available. But again, we're looking at those increases, and that's not a hopeful trend. So more and more people are suffering with this disease. So it is important that we continue to take this seriously. I know that many of you may have heard the reports of Wisconsin and some of the other places that are setting up their field hospitals, and let's do everything we can to prevent that from being us. I am hearing reports of parties happening. We are getting our contact tracers, are getting into situations where we're having parties from kids in school that are resulting in, 30, 40 kids being out and being notified to quarantine. Please, please do not host parties for any number of people, really. And do not send your kids to these parties. We really need everyone in the community to be on board with the measures that need to happen at this point. If we want to keep our community open in any way, we've got to be able to stay ahead of this and all use responsible behavior. So if you are interacting with anyone outside of your household, we are asking you to please wear a mask and engage in distancing. And please don't do it in the setting of a home party. This is not helping with our community transmission. It's not helping with our residents. It's not helping keep people safe and healthy. I have a lot of concerns with the upcoming holidays. I would ask you to re-examine your plans and think about what you can do to decrease the spread of COVID as it relates to those plans. I have concerns with college students coming back from college with the holidays, and perhaps what kind of activities they may engage in when they come home. Really reconsider your activities, consider your elderly relatives that you may be wanting to see, or maybe you were hoping to visit in a nursing home. The nursing homes are starting to see more cases. We're starting to see more deaths in Hamilton County. So again, I'm asking all of you to really reassess your plans, always wear a mask and engage in distancing if you're interacting with anybody outside of your immediate household. We too are going to be re-examining and reassessing the data and the research in order to provide the best possible recommendations we can and guidance going forward, whether that's in the form of orders and recommendations as we are moving towards our red category. So again, I'm calling on all of you to do what you can. We're going to be doing the same. Thanks so much for listening. Take care. Be really safe, everybody.